Greetings and welcome back. Today we're going to continue our discussion on blood flow through the heart, and specifically we're going to talk about the heart itself, and we're going to get the anatomy, the different pieces of it, and then along with talking about a heartbeat and the different components of this thing we call a heartbeat. And so for starters, you're going to be able to describe the anatomy of a heart in terms of size, layers, and coverings. These are the three things we're going to talk about anatomy-wise. We're talking about the function of these things called chordae tendineae and papillary muscles, so you know what those are and what they do. We're also going to distinguish between various stages of a heartbeat. So this is your components here. And then we're looking at two differences between the different nodes. So you can figure out what nodes are and how they are, or why they're important to us. So for starters, your heart is roughly the size of a fist. If you make a fist, so close your hand right now, make a fist, and then put it over top of your left rib cage, or just left of center of your rib cage. That is the size and location of your heart, roughly. Size and location of your heart. So you are bordered laterally by your right and left lungs on either side, and then in the front and the back, you're protected by your sternum. So in the back, you're protected by the spine. I guess in the front, you're protected by the sternum and your rib cage. Your heart's got three coverings. So we have a pericardium. So cardium, remember, for cardio refers to heart. Para means around or surrounding. So your pericardium itself has three layers. You have what's known as a fibrous pericardium. You have a parietal pericardium. You have a visceral pericardium. Visceral refers to organs. So this is going to be the layer that's closest to the heart itself. And then that heart, so there's three layers to the pericardium. There's also three layers to the heart wall or the heart organ itself. Here you have an epicardium, which is the outer layer. You have a myocardium, which is myo meaning muscle, and cardio referring to heart. So muscle, heart layer. And then you have an endocardium, which is the inner lining of the heart. It's important to note that your epicardium, your outer layer of the heart, and your visceral pericardium are congruent with one another. Essentially, it's difficult to distinguish where one stops and the other begins, is the gist of that segment there. Okay, so here's a look at it. So here's your heart wall itself with the covering. So this outer covering on the far outside is going to be your fibrous pericardium. Inside that, you have your parietal pericardium, which is there. And inside of that, you have your visceral pericardium or your epicardium from the heart wall layer. So this part here is very difficult to tell where one stops, the other begins. It's all kind of the same thing. From your epicardium, we go into this thick muscular layer called the myocardium, and then here we have our endocardium on the inside. Endo referring to the inside, cardium referring to the heart. So those are your layers, and the layers of the heart, as well as the layers of the coverings around the heart. Okay, here's one of your coloring packet diagrams. This is, again, looking at your endocardium, which is M on the inside. So this piece in here is going to be your endocardium. Your myocardium is the thicker portion. This is your heart wall, which is this piece here. You'll notice the myocardium is different on both sides. So your left myocardium, your right myocardium are different. Going outside of that, we have your visceral pericardium, which is O here. And this kind of runs down right behind N. Followed by your parietal pericardium and then your fibrous pericardium. So your parietal's here. Oop, I need a new color. That didn't work. So your parietal is here. And then your fibrous is on the outside, which is going to be shown by hopefully yellow. So there's your fibrous on the outside there. Okay, these are your different layers of the heart, and this is their locations and how they kind of function together. Okay, separating your different chambers are going to be these things called valves. And so you have two of them that separates your atrium from your ventricles, and then you have one that exits each ventricle. So between your right atrium and your right ventricle, where blood first comes into the heart, is your right atrium and your right ventricle, we have what's called the tricuspid valve. This is also called the right atrioventricular valve or tricuspid. You can use either term. But this valve prevents blood from going backwards from the ventricle to the heart. So prevents blood from going backwards. And that's what both of these do. So the first one prevents blood going back into the right atrium. The second one prevents blood from going back into the left atrium. Okay. And again, it's either tricuspid or right atrioventricular. On the other side, your left atrium and left ventricle separated by your bicuspid, also known as the left atrioventricular or your mitral valve. Okay. And a way to remember this is that blood flows from the right atrium to the right ventricle, and then to the lungs, and then the left atrium to the left ventricle. So you have to go through the tricuspid valve before you enter the bicuspid valve. So you have to try something before you buy it. So try before buy. It's kind of how I remember those, and in a way that you can remember those a little easier. Okay? And so to prevent your valves from swinging backwards and really getting into a pinch, you have these things called papillary muscles and chordae tendineae. So these papillary muscles are these guys down here on this picture, kind of shaded in red here. Those are your papillary muscles. The chordae tendineae are the actual cords here that go and attach to the valve itself and keep it open or keep it closed. Okay? And those are your papillary muscles and chordae tendineae. So the muscles themselves are small mounds of muscle protruding from the wall, and the tendineae actually attach to the valve themselves and keep them open or shut in some cases. And they keep them shut and they're forced open when things are pushed through, but this prevents backflow. Your pulmonary valve is located between your right ventricle and your pulmonary artery. So that's this guy here. I should grab a new color. Let me erase that quick. Let's go with green for the sake of going with green. So into this portion, you have your pulmonary valve, which is shown here. Okay, and then on the other side, we have our aortic valve, which is there. Okay, which prevents things from going back into your ventricles. Your pulmonary valve and your aortic valve don't need chordae tendineae because there's enough pressure exerted that it doesn't flow backwards. So these two, pulmonary and aortic, don't have your chordae tendineae and your papillary muscles. That's just your atrioventricular valves. That's due to the force of the ventricle contractions, which makes sure they stay shut and nothing comes backwards. Okay, and so along with all of the arteries that we're going to talk about in the body, you also have these things called coronary arteries. So coronary arteries are arteries themselves that actually supply the blood with heart, supply the heart with blood. And so these are these little guys running kind of all over the place here. These are coronary arteries that branch off of your major arteries and bring blood back to the heart so that it can get the oxygen it needs for its cells. Again, here's a drawing, our coloring page, so you see what you're kind of working with here. Here's a fantastic picture to study from. You're going to have a quiz on blood flow through the heart, so make sure that you are prepared for that. You can see this is my tricuspid valve here on the right side. On the left side, I have the bicuspid valve. So here there's two pieces. On this side, there's three. That's where the tri and the bi come from, as far as names go. Okay? And with your heart contracting, we have this thing called a heartbeat. And so one contraction is known as the cardiac cycle. And so there are a couple things that happen in this situation. So first, your atria have to contract. So your atria fill with blood, they contract. Now, when they do so, they push blood into the ventricles. So this is called your atria systole, which is a contraction. Okay? Your ventricles relax, which is called ventricular diastole, which is, again, just the relaxation step. When your ventricles contract, you have your ventricular systole, or the contraction piece, and your atria diastole, the relaxation. And so the atria force blood to the ventricles send it away from the heart to either the lungs or the body, depending on which ventricle we are talking about. Okay? And then your heart sound, if you ever heard a heartbeat, which we're going to listen to in class, but it has kind of a lub-dub, are the words used to describe a heartbeat. So lub-dub. Lub is the first beat. This is when your ventricle contracts, and the dub portion is when your ventricles relax. And because these are relaxing, your atria are then contracting. Okay? But this is your heartbeats, lub-dub. In order to make your heart work, to get your heart to continue to work, it has to be controlled by something. So we have these two nodes, which are independent of your nervous system, but they are kind of your electrical stimulators. So the first node is called the Sinoatrial Node, the SA node. This causes your wave-like contraction of the myocardium and acts as the pacemaker of the body. So your SA node, your sinoatrial node, is the pacemaker. Your atrioventricular node takes that signal from the atria down to the ventricles. This is a slow impulse, which allows your ventricles to fill prior to contracting so that they can pump as much blood as possible. That is your atrioventricular node. And then the last little bit's called an electrocardiogram, or ECG. This is the little station setup that has the heartbeat. So it goes like this, and it goes up and down, and it goes like this, and it goes up and down, and it goes like this. That's your ECG. Okay, electrocardiogram. And so this heartbeat has different parts to it. One is called the P. It's got a P wave, a QRS complex, and the T wave. And we're going to talk about this here shortly. But the P involves contraction of the atria. QRS complex is your contraction of the ventricles. And then T is your relaxation, your refilling portion. Okay. Again, here's another picture of the heart. Here's your heartbeat. Here's your P. Your atria contract here. And then your QRS, where you get a dip. This is all happening during your ventricle contraction. And then the last little bit is your T wave, which is where your ventricles refill. Okay? So this is the heartbeat in terms of letters and how we doctors kind of talk about them. All right, here are some questions for you to answer. Please make sure you work through these. If you have questions, be sure to bring them to class, as I'm sure that at least one of your classmates also has a question on the one that you are concerned with. But thank you for your time and attention today. I look forward to seeing you again, and we'll continue our discussion on the cardiovascular system.